नमस्कार, मेरा नाम सोनी है। जब मुझे पता चली कि मेरी प्रेगनेंसी है तब मैं रेगुलर चेकअप के लिए मैं जहाँ रहती हूँ वहाँ डॉक्टर के पास दिखाने के लिए गई। तो उन्होंने अल्ट्रासाउंड के लिए कहा और जब अल्ट्रासाउंड की रिपोर्ट्स आई तो उन्होंने कहा थोड़ी-सी कॉम्प्लिकेशन है और ये स्कार प्रेगनेंसी है।
Their doctor detects that there is a scar pregnancy, which is a complex pregnancy that happens rarely. So she suggests कि you should go for a better place for a better treatment because treatment is complex. So we came to Max Hospital. Here we meet Dr. Binita and Dr. Neena.
The patient Soni Gupta, she came in the OPD as a routine in the evening hours of the afternoon with having missed her periods about for 1.5 months and little spotting, little pain. We just got her routine ultrasound done and that showed that she was pregnant. Fortunately at the right place, that was a uterus, but in the area of her scar, she was a previous to cesarean sections.
And it shows that there is a scar, LSA cesarean scar pregnancy, which is showing ectopic. So usually pregnancies are of two types. One is intrauterine, another was extrauterine. That is ectopic. Ectopic ones usually it used to be happens in either tubes or ovarian or any sites in the abdomen also, but this is very rare which occurred in the cesarean scar, which was uterus was already given way towards the abdomen under the bladder.
After all the procedures, we were told that you need to go for surgery, and they immediately took my wife for the surgery.
So it became like an emergency. So in the late evening, we prepared her. And rather than opening up in this emergency, we thought we will like to do a laparoscopy for her. So we put in a laparoscope and we saw that there was bleeding in the part of the uterus where the scar had given way. There was a small baby or a fetus in its sac, which was about 6 weeks, was lying inside the abdomen. There was all adhesions between the bladder and the uterus because of her previous cesarean. So we could shave it off nicely and we removed all the products and then closed up that particular scar which was ruptured.
After that, my wife was shifted from OT to the general ward where she was recovering, and she recovered very fast because of the ecosystem that the hospital prepared so that patient can recover easily and feel healthy easily. Within 2 or 3 days we were discharged and we are very happy.
उन्होंने बहुत अच्छे इट मीन्स कि एक बच्चे की तरह उन्होंने मुझे बहुत अच्छे से ट्रीट किया, लाइक अ चाइल्ड, मतलब बहुत ही ज़्यादा अच्छे से। स्टाफ ने भी बहुत सपोर्ट किया, उन्होंने हिम्मत नहीं हारने दी मुझे। मैं जैसे कि बहुत ही टेंशन में आ गई थी और मेरे हस्बैंड तक भी बहुत टेंशन में आ गए थे।
So they treated the complex case in a normal way, so that was a very professional and very good gesture. So we thank Dr. Binita and Dr. Neena for treating our patient so well. Now she's completely recovered and now she's easily walking.
Had we left this patient unattended, she would have a lot of bleeding in her abdomen. The scar had already ruptured. Her BP would have fallen. Then blood transfusions would have been required. So all these nuances could have happened with this patient, but because of the timely action, everything went off fine with her and she was back home hale and hearty. So it is just for the knowledge of other pregnant patients who get pregnant earlier, that they should come for their antenatal checkup much earlier and get their ultrasounds done to at least see that their pregnancies are in the normal position and they are growing well so that there are no complications for them.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.